So many of you have been requesting videos on rosacea, especially since I talked about it being a skin condition that I personally struggle with. So I thought a good place to start is to tell you a little bit about what rosacea is and some do's and don'ts to follow if you have rosacea. I'm Dr. Sam Ellis and I'm a board-certified dermatologist. I'm here to help you understand your skin and find skincare products that work for you. First of all, what is rosacea? Rosacea is a chronic but treatable skin condition that typically involves the face. Now, I say treatable and not curable because sometimes patients will come see me in my office, expect to get a treatment regimen for 3 to 4 months for their rosacea, and then never deal with it again. And the reality is that rosacea is a lifelong condition, and there will be times when it's flaring and there will be times when it's under really good control. But the goals of rosacea management aren't to get rid of it because there's no cure, but to manage it in a way where it doesn't affect your day-to-day life and where you're happy with your skin. It's a persistent inflammatory skin condition, meaning that it often presents with redness and irritation, and I'll talk a little bit more about the signs and symptoms of rosacea in a minute, but it also affects men and women, though women slightly more than men, and it is really a disease of adults. So the onset of rosacea is usually after the age of 30. More than 16 million Americans have rosacea. That's about 1 in 20 people, and we think that globally about 5.5% of the world's population also has rosacea. Rosacea symptoms can include easily flushing or blushing, persistent facial redness, visible vessels on the skin surface, easily irritated skin, scaly skin, dry skin, itchy skin. It also can affect the eyes, so some people will get grittiness or irritation in their eyes. And the last thing is that rosacea can have pimples, and so it is often misdiagnosed as acne. Someone with rosacea might just have 1 or 2 of those symptoms, and someone might have all of the things I just listed. So it really can exist on a spectrum of severity, but also the presentation can vary widely from person to person. One question I get all the time is, why do I have rosacea? What is causing it? Is it something that I am doing? And oftentimes it's not. We know that rosacea is caused by the interplay of both genetic and environmental factors, but a lot of times people don't have full control over those. And so it's not about what's causing your rosacea at that point. It's more about, you have rosacea, what are we going to do about it? And it's great that we have awesome treatments to help get rosacea under control for people and manage those signs and symptoms so they're not suffering from their skin condition on a day-to-day basis. Prior to just a few years ago, we used to categorize people with rosacea based on kind of the main signs or symptoms that they were presenting with. I'm gonna go over those 4 categorizations, even though we don't really use those clinically anymore, because I do think it helps people understand the signs and symptoms that rosacea can present with. But just know we don't use those categorizations anymore because we understand that people with rosacea can kind of have overlapping symptoms that span more than one category. The first of sort of these 4 categories of rosacea is something called erythematothelangictatic rosacea. And really what this means is rosacea presenting with facial redness, and typically this is redness in the center of the face. So the chin, the cheeks, the nose, and the forehead. And this is redness that is often present at baseline, but then gets worse with flushing or blushing based on exposure to certain triggers. And then with that flushing or blushing, you can also have altered sensations of the skin, like sensitivity, stinging, burning, or sort of this overwhelming heat sensation. The other thing that can happen with this erythematothelangictatic rosacea is the presence of telangiectasias, which are dilated blood vessels that are visible on the skin surface. The second prior subtype of rosacea was something called papulopustular rosacea. And really this was rosacea presenting with red bumps or red pustules, which are red bumps filled with pus. This is the type of rosacea or a feature of rosacea that is most commonly mistaken or mistreated as acne. So it's something that's important for your doctor to be able to recognize. The third prior categorization of rosacea was something called phymatous rosacea, also called rhinophyma when it specifically involved the nose. But really this is the development of sort of a thick, bumpy texture to the skin. And it's not a common feature of rosacea, but it's certainly something to keep an eye out for. The fourth category of rosacea was ocular rosacea, or rosacea involving the eye. This will often present as irritation, light sensitivity, watering eyes, a gritty sensation in the eye. But like I said before, we are not using these 4 categorizations anymore. We know that people can have redness and eye symptoms, or phymatous features and papules and pustules. So it's more about what each unique person is presenting with when we're diagnosing and treating their rosacea. So Let's get into the do's and don'ts of rosacea. I just want to put a caveat here though, that these are guidelines, they are not strict rules. I know I'm a physician, I'm a board certified dermatologist, and I'm telling you these things about rosacea, but just know that everyone's skin is different. And if I tell you not to do something and you've been doing it and your rosacea is fine, it's no big deal. But these might be things that are worth thinking about if your rosacea is not under optimal control and you're trying to figure out ways for you to intervene and make a meaningful positive difference. See a dermatologist. We are able to accurately diagnose and give you a treatment plan for your rosacea. I cannot tell you how many times I've seen rosacea misdiagnosed as acne, lupus, an allergic reaction, eczema, seborrheic dermatitis. If your face is red or bumpy or sensitive and you don't know why, get the help of an expert to make sure you're treating the right thing. Get to know your rosacea triggers and then avoid those triggers. So although we don't know all of the causes of rosacea, we do know certain environmental factors make rosacea worse, and they can really vary from person to person. So things like sun exposure, hot or cold weather, stress, alcohol, chocolate, dairy, spicy foods. I mean, the list goes on and it really is unique to each person. What I recommend is that if you're not sure what your triggers are, keep a rosacea diary. Anytime your rosacea is flaring, write down what you ate, what you drank, and what your surrounding environment is like. Being more aware of your triggers and avoiding them will absolutely help your rosacea stay under better control. Protect your skin from the sun. So wide brim hats, please. And then sunscreen every single day. Now, I used to tell my rosacea patients to use mineral-based sunscreens only. So those with zinc oxide and titanium dioxide as the UV filters, because we thought they were maybe a little bit less irritating. But what I found over time is that a lot of my rosacea patients can tolerate chemical UV filters in their sunscreen just fine. So rather than limiting my patients' sunscreen options, I let them know that it might be a little bit of trial and error to find a sunscreen that they love, but once they do, use it every day. Keep your skin well moisturized. People with rosacea often will have some skin barrier disruption and be more prone to barrier disruption, even if they're using gentle skincare. So using a nice moisturizer that feels good on your skin, that doesn't cause stinging every single day, and maybe sometimes twice a day if you're feeling particularly dry, will help your skin feel better and look better too. And my final do is have realistic expectations of what's achievable when treating rosacea. Typically, the goals should be to have fewer flares and have your symptoms be well managed. But if your goal is to have zero evidence that you've ever had rosacea, you're really likely to be disappointed. And I'm not saying that to be Debbie Downer dermatologist over here, but if you focus on incremental improvement, you're much more likely to find success in your treatment and be happier for it. Let's get into the don'ts. I feel like I have to say this one more time before I get into the don'ts, which is if I tell you not to do something and you've been doing it and your rosacea is totally fine, that's okay. Keep doing it. These are not rosacea laws. These are just recommendations. Don't overheat your skin or expose it to extreme temperatures. Now, this can be tricky to do all of the time, but we do know that really cold weather and wind, as well as really hot weather and indoor heating, can all flare rosacea. Don't rub or scrub the face. So any type of physical manipulation or physical exfoliation can cause increased redness and irritation. So that goes for physical exfoliants like microbeads or scrubs, as well as even like the rough fibers of a towel rubbed on the face. They can all cause increased irritation. So pat your face dry, don't aggressively massage it. Just be nice to your skin. Don't use too many products. A simple skincare regimen really is best, especially if you're incorporating prescription topical medications to treat your rosacea. You really don't want to be layering product after product after product. You also might be sensitive to certain products, so doing a little patch test in front of your ear or on your jawline for several days before kind of using it all over your entire face is not a bad idea. Don't use certain skincare ingredients that are known to trigger rosacea. Not every person with rosacea is going to be sensitive to the same types of skincare ingredients, but in a survey conducted by the National Rosacea Society, there were some ingredients that more people tended to be sensitive to, and those are things like alcohol, witch hazel, fragrance, menthol, peppermint oil, and eucalyptus oil. There are other types of skincare ingredients like tretinoin and retinoids, salicylic acid, glycolic acid, benzoyl peroxide, antioxidants, and topical vitamin C. And people want to know, I have rosacea, those things can be irritating, can I use them? And really, it's on a case-by-case basis. One thing I recommend is never introducing more than one active to your regimen at once. So if you're thinking, okay, I want to introduce a retinoid, go low and slow and kind of see how it works out for you. I use tretinoin in my routine, even though I have rosacea, but I could not do that initially. I had to get my rosacea under really good control before I could incorporate that ingredient. I never want to say anything is truly off limits for my rosacea patients, but just know that you have to use things like acids or exfoliators with caution, and understand that even if you can't tolerate them at this point in your rosacea journey, you might be able to in the future. Don't be afraid to use prescription medication. I find that sometimes in clinic I meet resistance from patients who just want to use over-the-counter options, but this is a true skin disease, and I don't find that most of my patients want over-the-counter options for their other types of diseases that they have. Skin disease should be no different. Don't be afraid of the prescriptions. They are really developed for the treatment of rosacea. They have been well studied. Give them a shot. And my final don't is, if you have rosacea and you have not been able to get it under control, don't feel hopeless, okay? Team up with a dermatologist, maybe get a second opinion, and also understand that rosacea is constantly being researched. We are learning more about this condition day by day, and as we move forward, we are going to have even better treatments and interventions to offer. What tips have helped you with your rosacea? Put them in the comments below. Don't forget to give this video a thumbs up and subscribe, and I'll see you next time.